Hello, everyone. My name is Kiran and welcome to the Medical Career Job Fair. I will be discussing the benefits of being a pharmacist. As young adults, it is difficult to narrow down as to what career you would like to choose. However, I'm here to tell you about one of the options within the medical field, which is pharmacy. There are many options within the medical field, such as doctors, nurses, dentists, surgeons, and pharmacists. The number of years for every schooling within the medical field differs. However, for pharmacy school, there are two different options. One is a 6-year route, which is 2 years of undergrad and 4 years of pharmacy school. And the more popular and more recent route is 4 years of undergrad and 4 years of pharmacy school, and then 1 to 2 years of specialization in whatever specific area you would like to choose. You may be asking the question, why pharmacy? The reason pharmacy is so important is because pharmacists are known as the gatekeeper to patients' medication. This means that pharmacists are able to look at drug-to-drug interactions and contraindications within patients' medications, the one that they are currently taking and the new ones that the doctor is prescribing. They are able to keep the patient safe in order not to create more health issues. Not only do you use your chemistry knowledge that you have learned through schooling, you use math on a daily basis. More recently, pharmacists have been able to start administering more vaccines within the pharmacy. This has become more convenient for patients because now they do not have to make appointments with their doctor. They can just go in, fill out a vaccination form, and get their shot within 20 minutes. Another reason why pharmacy is so special is because pharmacists are able to counsel their patients. Counseling means that they are able to discuss the medication, the side effects, and whatever other questions that the patient may have about the new medication. And when doctors attend medical school, they only learn drugs and medications for 1 semester, whereas pharmacists have knowledge of up to 4 years where they learn about drug-to-drug interactions, contraindications, and more behind the chemistry of the drug. So pharmacists are able to catch doctors' mistakes and are able to correct them and confirm with them by giving them a phone call, asking them if it's okay to fill this patient's medication, knowing the drug interaction. When pharmacists counsel patients, they are able to tell them side effects and other important information about this specific drug. So according to the Pharmacy Times, this article I read, there has been an increased number of vaccines that have been administered by pharmacists. They are able to now administer influenza, pneumococcal, meningitis, shingles, the tetanus shot with the whooping cough, and hepatitis A, B, and C. This trend is important because it has made it more accessible for patients to get their vaccines without making a doctor's appointment. So a big issue that pharmacists are trying to combat right now is drug abuse, especially with opioids. They have been able to make it accessible for patients to get medication called Narcan, which is a nasal spray that patients spray into their nose in cases of overdose. Both children and young adults can administer this on a patient, and it's something that you keep at home. Pharmacists consult with doctors on why it's important that these patients who are getting opioids every single month to have Narcan at their home. And some other alternatives that pharmacists are able to prescribe to patients, something over the counter, or even the new drug coming out is CBD or cannabidiol, which also helps with pain relief, similar to opioids. So another important thing with pharmacists is that they are able to build relationships with their patients. Many doctors and nurses see different patients every single day and may not see them again because it was just a one-time thing, or they may have moved. However, most patients go to the same pharmacy and are regularly coming every month or every 3 months. So pharmacists are able to suggest different kinds of vaccines in order to make sure their vaccines are up to date, such as the pneumonia shot, which is every 10 years. Also, they are able to discuss with them why new drugs that doctors are prescribing may be harmful to them, because they know their regular history since they come in regularly. Another important thing is that pharmacists have a file of patients' health records, and billing and insurance information, so that each time they come in, we have the correct insurance and the correct area to bill. Another important thing that pharmacists are working on is called 90-day supply for medications, so that especially with older and elderly patients, that they only come in every 3 months for their medications. So they get a 90-day supply of their medication. So, because sometimes it is difficult to come out of the house, especially during the winter months with snow. So pharmacists have an abundance of knowledge, like I was saying. They spend 4 years learning about drugs and medication, whereas doctors only spend 1 semester, even nurses as well. So pharmacists are able to discuss with patients, according to the American Pharmacists Association article I read, possible side effects, what foods, drinks, or activities that should be avoided while on the specific medication, and what do you do if you miss a dose of your medication. Pharmacists are able to counsel their patients and discuss with them the path that they should take in order to help with these effects. And the last thing, now that you have had the knowledge and understanding and information of what it takes to become a pharmacist and the knowledge that you will need to become a pharmacist, some of the options that you can take as a young adult is becoming a pharmacy technician, and then becoming a pharmacy intern, and also lab technician and lab assistants also really help you become familiar with the different types of drugs and drug interactions that occur while people are taking their medications.